next speaker, Dr. P. MOUNIKA.
Good morning. I am Dr. MOUNIKA presenting COVID-19 associated Rhino orbital and Rhino orbitocerebral mucormycosis. Let's navigate into the complexities. Mucormycosis is a fatal fungal infection and it is a non-contagious disease which spreads by spore inhalation. Pathogenically, it's under three stages like angioinvasive, vessel thrombosis, tissue necrosis, and it occurs in two forms like Rhino orbital mucormycosis and Rhino orbitocerebral mucormycosis. We did a retrospective observational study over a period of 1 year during 2023 from Jan to December, during which we have comprehensively analyzed the diversity of presentation, management, prognosis in COVID-19 associated mucormycosis at a tertiary eye care hospital. A total of 69 cases were reported during this 1 year period, out of which 47.8% were Rhino orbitocerebral mucormycosis and 52.1% were Rhino orbital mucormycosis cases. And this is a pathological slide which represents the angioinvasive nature of the organism, where we can see the fungal hyphae within the lumen of the vessel and also within the wall of the vessel. Around 62.5% of the patients presented with no light perception during their first visit under the group of Rhino orbitocerebral mucormycosis. We had a varied diversity of presentations of these patients, starting from the conjunctiva to the retina, and there was almost an equal number of ptosis presentation in both the groups, and a higher percentage of presentation of patients with proptosis at around 31.8% in Rhino orbitocerebral mucormycosis group and 18.8% of lagophthalmus in Rhino orbitocerebral mucormycosis group, and there was around 37.5% of central retinal artery occlusion in the patients with Rhino orbitocerebral mucormycosis. In cornea, we had neurotrophic ulcers, exposure keratopathies, and neuro-ophthalmologically patients had orbital apex syndromes, optic neuropathy, and in retina, as we have seen, central retinal artery and vein occlusions were seen. These are few photographic representations of patients who presented to us. They had complete ptosis, neurotrophic ulcers, and dystopia. The patients were treated with 47.8% were treated with posaconazole and 52.2% received liposomal amphotericin B. These are the various procedures our patients underwent, like they underwent orbital decompression, debridement, maxillectomy, and excenteration. A higher percentage of patients under Rhino orbitocerebral mucormycosis group underwent debridement. Around 28.1% of recurrence has been noted in a group of Rhino orbitocerebral mucormycosis group, and there was a higher percentage of ocular morbidity seen in Rhino orbital mucormycosis group, which was around 8.1%. These are the various specialty requirements which our patients required during their initial visit. Almost an equal percentage of 75.7% in Rhino orbital mucormycosis group and 71.9% in Rhino orbitocerebral mucormycosis group required orbit clinic evaluation. These are the multi-speciality referrals which our patients required in their subsequent visits, and majority have developed invasive fungal sinusitis in their subsequent visits and required ENT clinic evaluation. So, in coming to the discussion, in the post-COVID era, a considerate rise was noted in neuro-ophthalmological manifestations and also cornea conditions. And as mucormycosis is an aggressive disease, an inadequate treatment might lead to progression of the disease from Rhino orbital to Rhino orbitocerebral mucormycosis over a period of time. So, early diagnosis and multidisciplinary approach is crucial for and life-saving to the patient. A periodic follow-up and comprehensive care is needed in all these patients. During this period, reconstructive procedures and rehabilitation was done in all of these patients, along with which our patients, we have created awareness how important was the follow-up during the post-COVID period. So the key message, COVID-19 has contributed to a surge in mucormycosis cases leading to severe ophthalmological and neurological complications. A timely and multidisciplinary intervention is crucial in improving the patient outcomes and reducing the morbidity. These are my references, and thank you.
Thank you. I think this was a very memorable time for most of the oculoplastic surgeons at that time. So thank you for reminding those days again. It's a good series, but what is your observation regarding the feeling of gratitude by the patient to save the life and doing exenteration or debridement, whatever? Have some feedback. Just I want to know because we all of have came across with all these things.
Sir, actually, even in post-COVID era, like patient had manifestations in their ocular conditions. So few patients have come only for rehabilitation, and because it's like at least the spread was cessated, the patients were happy that they are alive.
See, one point is that though we suffered COVID, the COVID phase is right now over. So, regarding ocular these findings, what do you want to suggest? What was the etiology actually?
Ma'am,
In COVID
actually,
patient.
because they have developed diabetes and their immunity was suppressed, and we were not able to combat the infection, even though we have started aggressive managements. It's like recurrently periodic follow-ups and comprehensive care was needed in these patients. So creating awareness was also important, and they were still coming for lots of follow-ups till date. Few patients like.
And the next question is that why did they develop diabetes most of the cases? This is a very interesting
Steroid usage.
Exactly. And one more thing, okay, you have one more paper on orbital macromycosis, so I'm not going to comment right now. There are some points to be added. So, in fact, I wanted some take-home message from you.
I just wanted, like, even the COVID has been subsided, even in the post-COVID era, public should be aware of the consequences. Yes.
Okay, thank you so much.
Thank you.